If you've experienced nerve pain after having shingles, also known as postherpetic neuralgia, gabapentin extended-release tablets may be an option for you. This medication is classified as an antiseizure drug and is used to help relieve the pain caused by the shingles rash. The extended-release formulation means that the medication is released slowly over a 24-hour period, providing continuous relief. It's important to take this medication as directed by your healthcare provider. Typically, the daily dosage is divided into 2 or 3 doses, and it's best to take it at the same times each day to maintain a consistent level of the medication in your body. Be sure to follow your healthcare provider's instructions for the best results. Before you start taking gabapentin tablet, extended release 24 hours, make sure to read the medication guide provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, usually once a day with the evening meal. The dosage is based on your medical condition and response to treatment. Swallow the tablets whole and do not crush or chew them, as doing so can release all of the drug at once, increasing the risk of side effects. During the first 2 weeks of treatment, your doctor may gradually increase your dose so your body can adjust to the medication. Take this medication regularly to get the most benefit from it, and to help you remember, take it at the same time each day. Do not take this medication more often or increase your dose without consulting your doctor, as your condition will not improve any faster, and your risk of side effects will increase. Do not stop taking this medication without consulting your doctor, as some conditions may become worse when this drug is suddenly stopped. Your dose may need to be gradually decreased. If you are also taking an antacid, it is best to take gabapentin at least 2 hours after taking the antacid, as antacids containing aluminum or magnesium may interfere with the absorption of this medication. Different forms of gabapentin are absorbed in the body differently, so do not switch from one form to the other without consulting your doctor. Finally, tell your doctor if your condition does not improve or if it worsens. Some common side effects of gabapentin extended release 24 hours include drowsiness, loss of coordination, and dizziness. If these effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as swelling of the hands, ankles, or feet. Additionally, a small number of people taking anticonvulsants may experience mental or mood problems, so it's important to seek medical help if you or your family notice any unusual changes in mood, thoughts, or behavior. In rare cases, a serious allergic reaction to this drug may occur. Seek medical help immediately if you experience symptoms such as fever, rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you experience any other effects, it's important to contact your doctor or pharmacist. Before taking gabapentin, make sure to inform your doctor or pharmacist of any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have kidney disease, mental/mood problems, or a history of drug/alcohol abuse. Gabapentin may cause dizziness or drowsiness, so it's important to avoid driving or using machinery until you know how this medication affects you. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana, cannabis. If you have surgery planned, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, so it's important to be aware of potential symptoms such as swelling of the hands/ankles/feet, slow/shallow breathing, dizziness, or loss of coordination. These symptoms can increase the risk of falling. If you are pregnant, it's important to discuss the risks and benefits of using gabapentin with your doctor, as this medication should only be used when clearly needed during pregnancy. Additionally, gabapentin can pass into breast milk, so consult your doctor before breastfeeding while taking this medication. It's important to be aware of potential drug interactions with gabapentin tablet, extended release 24 hours. Always keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with this drug is orlistat. The risk of serious side effects, such as slow/shallow breathing and severe drowsiness/dizziness, may be increased if this medication is taken with other products that may also cause drowsiness or breathing problems. Inform your doctor or pharmacist if you are using other products such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Always check the labels on all your medicines because they may contain ingredients that cause drowsiness. It's important to ask your pharmacist about using those products safely. Do not use this medication with other medications that contain gabapentin, including gabapentin and acarbol. Additionally, this medication may interfere with certain lab tests, potentially causing false test results. Make sure lab personnel and all your doctors know you use this drug. If someone has taken too much gabapentin tablet, extended release 24 hours and is experiencing serious symptoms like passing out or trouble breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of overdose may include vision changes, severe drowsiness, trouble speaking, and weakness. It's important to remember that gabapentin tablet, extended release 24 hours, should not be shared with others. This medication is prescribed specifically for you and should not be used by anyone else. Sharing medications can be dangerous and may cause harm to others. So, always keep this medication out of reach of others and only use it as directed by your healthcare provider. If you forget to take a dose of gabapentin tablet, extended release 24 hours, you can take it with food as soon as you remember. If it's close to the time of your next dose, just skip the missed dose and take your next dose at the regular time. Remember not to take a double dose to make up for the missed one. It's important to store gabapentin tablet, extended release 24 hours at room temperature, away from light and moisture. Be sure to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, consult your pharmacist or local waste disposal company for proper disposal. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.